The Optional State Supplementation Program is a critical program that is used to provide, in large part, the personal needs allowance for the residents. So this year, we have been working with the Department of Children and Families, and we have certainly been working with other lawmakers up at the Capitol to try to formulate a plan to help improve the level of reimbursement for the personal needs allowance. Right now, it's at $54 a month. That rate has not changed since 1999. So why is this important? Well, the reason why this is important is because a lot of residents have Medicaid, Medicare, and of course, if you have Medicaid, Medicare, you are exposed to co-payments. Oftentimes, a co-payment could cost you as much as $8.50 for one prescription. This becomes a significant barrier to treatment. So one of the objectives that we have is to ensure that we get the language inserted into the budget bill, perhaps through proviso, to allow the Department of Children and Families to use the surplus dollars that has been accumulating on line 360 of the budget, that's both in the Senate and the House, line 360, in order to ensure that the surplus dollars can be used to increase the personal needs allowance.
I want to ask you a couple of questions about some of the most important issues facing assisted living facilities today. What's most important on your mind right now?
Well, today we're working on the OSS issue, trying to get more funds, more personal funds into the accounts of our residents.
Well, you know, that's an important issue because what we know in the last several years is that, in fact, the OSS line item lost $1 million. And there's been a great deal of discussion about taking some of that money and pushing that money into other types of programs. I asked them to redirect some of those dollars back into the personal needs allowance and make sure that residents have increased funding for it. So tell me a little bit about the personal needs allowance at your facility and how important is it to residents?
Their personal needs allowance is very important. Right now they are receiving $54 a month. Out of that comes their any type of medicine copays, any type of doctor copays, any copays that they have to take care of. And then after those are taken care of, then they have the little amount to spend on things that they want to spend it on, which doesn't amount to a whole lot.
Pascal, tell us a little bit about what's going on with you today at the Capitol.
Well, today we're just trying to talk to Congress people to try and bring awareness to the underfunding of our facilities and the regulations that we must comply with, which is with the rate that we are reimbursed, it's almost impossible.
This year, we're really holding out hope that the lawmakers will get together and start to make this a priority. We've been very optimistic. Some of our meetings, a lot of our meetings. In fact, I haven't run into one lawmaker to tell me that, hey, they don't think this should be a priority. So we're really...
There's definitely a crisis out there that hospitals are unable to discharge people at the present time because there's no facilities to discharge them to. So they're holding up hospital beds, and then they're either being thrown onto the street where they roam homeless, end up back in the hospital. It's just a never-ending cycle because there's no placement for them. You can't take a resident that's $750 a month. It doesn't make any sense,
Right now in Florida, Pascal, we're being paid $12.25 a day from the Medicaid program for assisted care services. So this year we're proposing to take it up to $15.25 a day. Most of those dollars, most facilities would use that to fund staff increases, wages, and keep pace with liability insurance.
And staff costs money. And the funding. Can you live off $12 a day?
So in a lot of cases, this is the reality. The reality is that the facility owners are carrying the weight for a lot of these costs. These are hidden costs associated with the care of some of the most complex populations that we have in Florida. And so when you think about the other weights that are upon the cost structure, I know liability insurance rates went up 20 to 50% is what I'm hearing all throughout the state of Florida. So that's got to be a concern for you as well.
Yes, it is. The small facilities, the ones that house the OSS limited mental health, we receive the least funds, but yet our costs are the same as those private industries when it comes to any type of copay, any type of insurance, liability insurance, any type of licensing. We still have the same costs.
That's correct. So this year we have making a major push. Florida Assisted Living Association and the facility owners are making a major push, asking lawmakers to increase the Medicaid assisted care services rate from $12.25 a day to $15.25 a day. That's a $3.6 billion statewide impact. And that will be an important objective in the budget process that's unfolding right now.